Hi, and welcome to the Psych, Health and Safety podcast, first ever live event. My name is Jason Van Shee, and I'm one of the hosts of the regular podcast that features new episodes weekly. The aim of our podcast is to rapidly increase the knowledge and application of psychological health and safety in workplaces worldwide. We're thrilled, absolutely thrilled to have over 1,000 people who've registered for our first live event. But look, when we were talking about this event and what we could do out of it, we thought of no one better to moderate this event than a health and safety professional, Wade Needham. So I'm going to introduce Wade onto the show now. How are you today, Wade?
Good, Jason. How are you?
Yeah, no, it's a little bit awe-inspiring, really, to see that there's so many people interested in this area.
I think it's just natural. I mean, I spoke at an event 2 years ago in New Zealand, and I was happy to tell people that this is going to become front and centre for the profession, regardless if you're in HR or WHS. And I think just even as we continue to advance in our understanding and knowledge, it remains at the forefront of a lot of people's desires to be better in this space.
Yeah. Now, Wade, you're guest number one on our podcast. We've since had about 30 guests on the show. Why did you put your hand up to moderate this live panel event?
I think for me, it's around asking those questions that a lot of people find it hard to answer. I think in this space, there's a lot of people, and a lot of people really come at it from very different perspectives and different backgrounds. And it's really around how do you pull all those threads together to find your next step to move forward in this area in the business you're in. And to me, it's around serving that niche of the profession to find, hey, there's great regulatory guidance out there from SafeWork, both New South Wales and others in the area. But how do we answer some of those contextual queries and get really to the nuts and bolts, to get in the people's heads that are part of these discussions, but also may have had more experience than other people out there.
Yeah, I totally agree, right? Like you said, there's just so much information that's out there already. But what we're not seeing is a lot of application. I know that some of the people who are on this panel today have been working in the space for more than a decade, right? And you'd expect, given how much good information is out there, that far more organizations than are currently would be taking more of a risk management approach and looking to deal with work-related stress systemically rather than the popular approach, which is largely focused on symptoms and individuals.
Correct. And I think today it'll be good to sort of speak to people to sort of acknowledge where we're at broadly within industry, and then secondly, sort of where we're headed and how people can accelerate that transition. So by no means out of today do I want people to feel that what they're doing is currently poor or sort of bad or anything like that, but it's a natural progression. The more we understand about something, the lower our tolerance for risk is about it, and how we account for it, and then we identify those steps to take it forward. So, it's a natural progression. I think people need to feel that they can take the next step. And I hope today that, there'll be a lot of questions and answers that come from that and give people that confidence to move forward.
Terrific. Yeah. So for the audience, the way that today is going to run is that we've got about 50 to 60 minutes worth of a roundtable discussion with some amazing experts who I'll introduce in a moment. And then we're going to open it up for questions. So if you're watching the live stream on either LinkedIn or YouTube, then just pop a question in the comments box, and we'll hope to get to as many of those as possible in the last half hour of the session. So yeah, look, the show, I've actually got it easy today. I'm actually not on the panel. I'm just doing the intro and outro. So let me take this moment to introduce the rest of our panelists. So from People Diagnostics, we have Joelle Mitchell. Welcome, Joelle.
Thank you, Jason. How are you?
Yeah, I'm good today, actually. Yeah, I normally ask you how you're doing on our podcast, so it's nice to have it turned around. No, I'm doing good. Really excited again to have so many people tuning in for this event, and if they can't make it live, then hopefully they're seeing it soon afterwards. But you're ready to participate in this?
Yeah. When I saw this morning that we've exceeded 1,000 people registered for the event, that was a bit of a bit of a moment. So the numbers have been climbing pretty steadily, but 1,000 registrants is pretty overwhelming. So no pressure.
You haven't got on your mindfulness app yet?
I'm always mindful.
Great. All right. So next up we have Ian Firth from SafeWork New South Wales. He was on episode number 11. So welcome, Ian. We have Jennifer Lowe from Australian Chamber of Commerce and Industry. She was on episode number 17. And Carlo was one of our OG guests on the Psych, Health and Safety podcast as well on episode number 5. But what I'm going to do now is I'm going to get off here, and I am going to allow you guys to have a great roundtable discussion.
Perfect. Thanks, Jace. Welcome, everyone. Great to have you all here. I think Jason did a really good job of introducing and why this topic's important. And so what I'd really like to do is we all come from very different backgrounds. We all have very different roles. And so just initially, I would like to place into context this discussion. And so really, it is very challenging for people to talk within both their current roles, but also where they're currently at from professional development. So today, I do just want to acknowledge that people are discussing their context and their perspective from an individual personal perspective rather than the organizations in which they're representing. So please, any discussion that comes out of this, whilst it's not, we're not trying to say that none of this perspective is, focused or may find its way to the organizations we represent. What we'd like to have is an open, transparent conversation around that, allowing us a little bit more freedom than what we probably likely have if we were representing the organisations we currently are in. So please, the queries if they can more attack the discussion and the context of the discussion rather than asking for official positions. If you want official positions of any of the organisations we represent, please go through those representatives and those teams and what's freely able there on the internet. So with that, what I want to do is sort of open up and say, well, hey, it's really important to put this discussion into context because of the different streams and backgrounds we're in. So really what I'd love to do is sort of give each panel member a chance to sort of outline both two things to us is around what does psychological health and safety mean to them? And really to the second one is around how do they think that this area is actually seen within their either constituents or peer groups that they work with day in, day out. And that might be either the same and similar, or there might be a few gaps as well. So Ian, I might just chuck to you first, whether you can sort of give us a bit of an outline of that. And then when you're finished, feel free to hand over to someone else on the panel.
Yeah, Wade, no worries. So from my perspective, working for the regulator, psychological health and safety is very much linked back to the work health and safety legislative framework. So, what I often hear from the inspectors and the businesses that I visit is that they'll go to Google or they'll go to a search engine and type in mentally healthy workplaces, and then they'll be overwhelmed with all the information. And then it's a matter of me as an inspector, I guess, and being kind of focused on that psychological health and safety space of just saying to them, let's kind of narrow that funnel a little bit. And we're getting down here into the management of risks, the prevention of harm, or if you want to think about it looking through the lens of the integrated model, we're in the prevention space, not in the return to work space here. So that's kind of what psychological health and safety means to me, very much around the psychosocial hazards and the management of the risks of those hazards. In terms of my peers and my constituents, I guess I've got two kind of broad groups of, I call them customers. I've got the inspectorate here in New South Wales that I'm a resource for, but also workplaces here in New South Wales. And I think there's some differences from those perspectives, but some of the similarities are that they probably struggle to understand what the legal requirements are. The Work Health and Safety Act sets out kind of broad duties across all hazards, physical and psychosocial. So some of the common, I guess, linkages between the inspectorate and industry are that they both, I guess it's a bit of a challenge to try and understand how psychosocial hazards are enforced and where they fit into that legislative framework. So they're probably a bit of a commonality between those two groups, Wade.
And I guess we're seeing that broadly coming out with recently the state ministers getting together and issuing that communique and that recognition that maybe more explicit guidance is required within the regulatory framework. So good answer. Jennifer, I might chuck to you on this and your definition and also the constituents and peer groups that you work within.
Yeah, thanks, Wade. So I guess from a personal perspective, my background was psych, academia, so I do tend to take an academic approach first and then apply the OSH and the HR and the business perspective on top of that. Personally, I avoid the use of the term psychological health and safety because to me it conflates the public health WHO psychological health definition with this whole risk management concept because of the safety brought in with the health. So to me, it's a confusing term. I'd rather focus on psychosocial risk or psychosocial hazards being the more specific thing that we want to talk about with people. And certainly there's a lot of work that needs to be done to educate people on that term and what it means. And I guess for me, that's one of the key things I'm looking for over the next 12 months in particular, now that there is more of a conversation about psych health and safety, psychosocial risk, that we actually seek to have some sort of common understanding of what that means, some national consistency in these definitions and in this understanding, so we can start to bring workplaces along, who I mainly represent day to day, small business owners in particular, helping them to understand what this looks like.
Perfect. And it can be quite confusing. Obviously, there's multiple levels of impacts and focus coming in. And I can imagine, as you know, I've been a small business owner when I first came out of university, and having the regulatory wave come at you associated with all those different things of employing people and dealing with it. It was quite challenging being both young and trying to run a business. So I can imagine, if people that are listening to this event still have queries, I can imagine the broad consensus even with the small business and medium business community is that there's still some way forward and how to explicitly provide a roadmap for those people.
Yeah.
Lovely. Carlo, I might throw to you, please.
Thanks, Wade. Hi, everyone. In terms of defining what we mean when we're talking about psychological health and safety, I think we need to keep it pretty simple because it is confusing for a lot of people. For me, what we're talking about is all of the things that you can be exposed to at work that could have a negative impact on your psychological health. And so I think some of the confusion comes from whether we should focus on outcomes or whether we should focus on hazards or risks, as Jen was referring to. So for me, that's how I think about it, and I tend to go to the hazards and to think about those hazards and how they are potential sources of harm. That's just what a hazard is, which is potentially causing psychological harm. So I like to keep it simple like that. In terms of how people view it, I think that how people have viewed this area has changed a little bit over the last 10, 20 years. We've come a long way, but we've still got a long way to go. I think we still get caught up with issues around how people view mental health and the connotations of that phrase and the stigma attached to that phrase, and how that is also typically focused on outcomes. So people go straight to an outcome, and to quite a severe outcome. And of course, I think that the focus really needs to be on the potential sources of harm and all the harms along the way to those potential quite serious outcomes. So I think we're evolving, but there's a lot of work to do. And what I'd like to see is organisations as familiar with psychosocial risks or psychosocial hazards as they are with any other hazard, so that they can talk about each of the psychosocial hazards as well as they would talk about noise or dust or silica or any other kind of hazard. So that's where I'd like to see us get to.
Perfect. And I think I might just throw to Joelle here, and I think that's, you sort of touched upon, there is a positive aspect here, whereas often in the physical safety side of things or sort of traditional safety, it's been very much around preventing acute incidents, incidents that occur with sort of, activity outcome. And so there's a continuum here, both of harm being caused through to then diagnosable injury and recovery, but also there's a continuum on the other side as well, when there's both not hurt, but pass that into opportunities to thrive, be content and to really live a very engaged and well life. So Joel, can you just touch on some of those components as well?
Yeah, absolutely. Thanks, Wade. And I think that's an important part of the picture for workplaces as well, that there's hazards there that need to be addressed, but there are also protective factors in work, and we know that good work is good for us. People who are engaged in meaningful work are actually at a lower risk of developing psychological ill health than people who don't work for whatever reason. So we know that there are lots of elements of work that are actually promoting positive mental health, and so I think that it's equally about reducing the hazards or reducing exposure to the hazards, but also looking at how we can enhance the positive and protective factors of work for people and actually try to help them move up along that mental health continuum into, a state of mental health that's sound, but then also even further along into that flourishing and thriving state. And then there's, enormous benefit for an employing organisation when they've got members of the workforce who are in that flourishing state.
Yeah, and I think from this point is that where most businesses are very acute and understand how to sort of track and account for loss type events, and insurance makes that quite easily. Within things like net incurred costs and estimating for how much do events. I would put a clinical and lost wage capacity on it, but it's a little bit harder to sort of track and understand the positive benefits, and so I think there's probably a slower uptake in both the belief of that. But I'm pretty buoyed by the fact that the rise of the environmental, social and governance type focus around businesses that act in a sustainable manner, that provide, and look after their people, tend to perform better from a performance perspective sustainably over the longer time. So I think this is one of those risks that truly force both safety people and people in culture to understand that there is upside to risk, and risk is really uncertainty on objectives. And so I think this can be seen as both a prevention of cost and lowering of overheads, but also a competitive advantage in businesses. But often that message is quite easy to say, tough to quantify, and that's sort of a thing that would be great to hear a little bit more, Jen, around. So there might be some small and medium businesses that say, well, look, we look after our employees, we've got really tight relationships with them. Are you just over proceduralizing what good employer-employee relationship really means in this space? Do I need to do more rather than caring for my employees like I already do?
Yeah, Wade, that is a tough one, and it's this constant, I guess, tension between promoting good mental health and everything Joelle just talked to, and then the risk management side. And for me, it's even more complicated when you put on top of that a small business and their structure and resourcing and capabilities compared to that of a medium and large. So a small business who doesn't have HR, who doesn't have work health safety, but it's pretty much the owner or maybe an executive if they have a second tier looking after everything. And the feedback we get is they are much more engaged with their staff. They naturally talk and connect more because they need to keep track of the handful of staff that they have. So there is a greater sense of that relationship and understanding of who's doing what, and there tends to be better communication than what you see in medium and large. So for me, they're already doing things quite well that they might not consider as protective type actions or even risk management controls. So it's about educating them on what are you already doing, how could you build off that, versus saying here's a bunch of new regulations and new things that you have to do. Whereas for the medium and large side, I think it's almost bringing them back to basics of management 101 and good communication and good engagement, because they have a million policies and procedures, and sometimes it misses that human element side. So I think we've got quite a few different challenges that will need to be worked through over the next few years.
And Ian, do you see from your perspective, when people are coming to you and they're on site dealing with employers, have you got any case studies where, or examples where people aren't really quite sure because there's just different legislation? We've got in this area, we've got, WHS, we've also got, Fair Work, we've also got discrimination type legislation. Do you find that a lot of people find it really hard as to where to look rather than sort of straight physical type safety risks?
Yeah, I think so, Wade. I think a lot of scenarios that will happen in a workplace that, you in a bigger business, your HR, WHS officers or managers need to deal with, or in a smaller business, the actual business owner themselves need to deal with, can often have an intersection where different pieces of legislation might be relevant to them to consider. Scenarios where somebody might be coming back to work, with a psychological illness or injury that's possibly not work-related, or that possibly hasn't been caused at work. There may be issues with their performance that the business needs to try and deal with. So scenarios like that really got a bit of an intersection of workers' comp legislation, injury management legislation, some industrial legislation. If there's a diagnosed disorder, possibly even some anti-discrimination legislation, and then workers, work health and safety. So definitely there are situations where that, and I think in my experience, we haven't seen this quite as much in the physical hazard space, definitely. And businesses often, sometimes when I visit workplaces, the majority of times people just aren't sure what to do. They don't know. If I do keep going to them and asking them what's wrong, one of their teammates may have told me confidentially that confidentially that they know that there's all these issues happening in that worker's home life. What do I do if I go up and ask them that? Am I putting pressure on them? Am I then liable? Have I gone too far? What do I do if they break down in front of me? What am I supposed to do then legally? What do I need to do there? And so, definitely there are scenarios where businesses, particularly frontline managers and small business owners, have kind of got all these concerns and these worries, I think, when I visit the workplace. Yeah.
So, Carlo, from that point, we're getting into, we've got multiple bits of legislation. We've got, different levels of understanding. We're really starting to set in the territory of the too hard basket. So how do we bring that back down? And have you got any advice that, if someone's sitting out there and they need to have a discussion with their exec team or their leadership group about this issue, how do they keep it back down to that size of sort of manageable, but also giving people confidence that they can do something about this as a leadership group?
Well, I don't think it's in the territory of the too hard basket. I think it's very firmly, deeply inside that basket, and it's been there for years, unfortunately. I think that there are ways out of that. The first is we've got to stop saying it's too hard. We've just got to stop that. It's not that hard. It's solvable. It's doable. If we were talking about complex financial or accounting issues, we wouldn't just throw our hands up and just say, oh, too hard. We'd solve it. So the first thing is you got to solve it. And whether you're large or small or whatever, it can be worked through, and you just got to be confident enough to know that there are steps you can take and advice you can get to help you through it. So, I think it's important to get good advice should you not have it in-house. That's one thing that's not always accessible to everyone, of course. But I think we also need to think about some really basic foundational information that people need on these kinds of hazards and how they relate to the different pieces of legislation. So getting back to basics, I think, is really, really important.
And if we were going to get back to basics, obviously having psychological in it, obviously most people lean to getting advice from either a psychologist or a social psychologist or either an individual. Jen, from that perspective, with your background, how suited do you think is the profession, of a clinical body of knowledge applicable to work, and how does that sort of interplay sort of occur, considering you're probably one of the earlier individuals that's coming into the organisational space? Do you have any sort of feedback as to how that can really integrate well with business planning and design?
Oh, Wade, putting me on the spot here. Well, I guess I haven't been shy in saying previously that I don't think clin psychs are well equipped in this space, or org psychs, to be perfectly honest. I think it really requires a multidisciplinary approach. I think we need to learn to work better in terms of integrating the legal discipline, the work health safety, traditional practitioners, the org psychs, the clin psychs, the HR, the workers comp. Like we really have to bring everyone in. What I do think works from the clinical and org psych perspective is the structure and the thinking and the ability to look at predisposing factors, protective factors, risks. They have that natural understanding of, let's work through the context, let's look at how that individual's interacting with their environment, so they can in some ways more easily identify specific hazards, although they might not call them hazards. Whereas I think from a workplace safety perspective, there's a lot more teaching in terms of what do specific psychosocial hazards look like, and then they can apply the traditional risk management approaches that they've learned.
And I know it's putting you a little bit on the spot, but I wouldn't. In some respects, it probably could be, but at the same time, we don't typically hire occupational surgeons to come in to provide risk management advice in our business. So I think this is one of the things that we often have is around who do we go to for this type of advice. And I think the other part is, this is risk really, and embedding this. We already have risk processes in our business. So, Ian, just throwing to you is around if I was going to take my existing risk process, which I've embedded in my business, I might not be at the level of 48 or 4501, but I've got a risk process in my business. How can I upgrade that by using sort of additional taxonomy or additional process to get this on my risk register to facilitate something? What could that look like?
I think if you've got a system that relies on the use of a risk register, that's a pretty practical way to start. I'd say to business, whatever system you're using at the moment, let's have a look and see whether you can start to modify it and amend it to start to include some of those psychosocial hazards, rather than having to reinvent the wheel and start from scratch or having a separate kind of process. That's probably the best way to start to think about it. And, when I visit a workplace, I just want them to start somewhere, just make a start somewhere, just put something on the risk register, just get one of your HRs trained in this area, just get your WHS manager or your WHS officer, more training in this area. So I think there's some issues around competence often when people are trying to start to incorporate psychosocial hazards into their existing systems. Definitely training and competence is one of the first places to start, but then also your actual systems, do you use risk registers? And I think if you've already got an existing system, one key point I would make, I think, is if you've already got an existing system, we would hope, given that consultation is such a huge part of the Act and the regulations, that you've got some pretty strong consultation mechanisms. And in the area of psychosocial hazards, you really need to talk to the workers around what this system's going to look like and how you're going to expand it, because not every, you don't have to address every psychosocial hazard in your risk register. You don't have to list every psychosocial hazard, in your risk register. It really needs to be driven by the workers and what they're seeing and what they're facing and what their experience of the demands of their job versus what sort of resources they have to be able to meet those demands. So, probably a couple of key things there. Yeah, you don't have to reinvent the wheel. Make sure you got your training and your competence, or make sure you're at least thinking about it, and make sure that you're expanding your consultation mechanism so that you can start by consulting with the workforce and finding out from them.
Yeah, and is the danger, Joel, that existing safety and HR professionals run to Safe Work Australia or Safe Work New South Wales guideline, grab the taxonomy that are in there for here are the hazards, and then plonk them into the register, and then job done? Like what does better look like other than doing something like that to tick the box?
Yeah, I guess that's always going to be sort of the default approach, I think, and an element of that is to do with how comfortable people are with the content and understanding the concepts. And I think a little bit there's quite a lot of apprehension when people who aren't mental health professionals start thinking about things to do with psychological health, and they just get quite worried about it. They think that it should just be dealt with by mental health professionals, and that there's not a role for other professionals in that space. So yeah, while the guidance I think is definitely useful to get people starting to think about, hazards, rather than thinking about treatment, which is I think where a lot of that caution comes from. If you're a HR professional, if you're an OHS professional, no, you're not supposed to be treating somebody who's already mentally ill. It's about actually identifying the hazards that you have control over, or that your workplace has control over, eliminating them where possible, or else reducing people's exposure to them. That's the standard approach that we take to hazards. So I think that having a taxonomy or a list is a useful starting point. But the consultation is absolutely critical, because, you can talk about workload as being a hazard, but you still need the context from the workforce about what elements of the workload are actually causing me the most stress, and what's going to be a solution that's actually useful in this space. Because just giving me some time management training, that's not actually going to help me if the volume of work that I have to complete exceeds the working hours that I have available to do that work. So I think that if you're comparing this to something like an engineering approach to process safety, the workforce consultation element of this is a lot more critical, because it is the individual factors, I think, are a lot more important.
Yep. And Carlo, from this perspective of having consultation, we've got a list of sort of predefined or areas for us to consider or to consult on should that area of risk be in the business. It's a good signal for us. But once we've got that signal, I think there's a choice of either do we go down and continue down the bad apple approach and go treatment, or do we actually look at the barrel itself? So if we were going to look at the barrel, this can be either individual, team, site, organization. Sort of, how do you break that down into more manageable chunks to start with?
Sure. It should always be looking at the barrel. You should always be looking at the system. I think we get distracted when we start going down the line of treating individuals, and even down the line of individual vulnerability. It's a distraction. It's the thin end of the wedge. What organizations are supposed to do is think about how the work that they're getting people to do and that whole work system might affect their health, whether it's psychological or physical, right? That's kind of what I mean by getting back to basics. How does the work system potentially affect health? The lens we're using now is just psychological health, right? And so then you break it up into, well, how the hazards are typically broken up. I mean, often there's lots of ways of doing this, but one way is to think about how work is organized, social factors at work, and factors of the work environment. And I can outline some of those if that's useful. But that's typically what we do. Can I go back a bit and just reflect on some of the other points as well?
Go for it.
In addition to consultation being important, consultation done properly is really important. It's usually not done very well. It's Clayton's consultation. Meaningful, engaged consultation and participation is critical. to understanding how the hazards might be present and might play out in the workplace. But in addition to that, I think one of the themes that's been going through what we've been talking about is about understanding context. Understanding the context of the organisation is the first step in a risk management model. It's the first step in the standards on health safety management systems. And understanding that context responds to some of the issues that Jen was raising earlier about smaller workplaces, small businesses who have a context where they have fewer people, where they don't have WHS staff or HR staff, but they have greater contact with their people. That's part of their context. And so if they start by analysing their context, which says we do these things really well already, then that's helping them to understand which of the hazards which of the psychological hazards they might need to consider further in terms of assessing the risk associated with them. So, we always go to identification, assessment, and control, but context, I think, is the really, really important place to start because it informs the identification and the assessment and the control. I just wanted to come back to that because we'd kind of been talking about it a little earlier.
Yeah, and that it's a good point, and Jen, I might chuck to you on this, is that certain businesses and industries are under certain constraints because of the model of the business. So I think that's also worthwhile acknowledging that whilst there is some areas of business that can be rearranged and reorganized quite easily, there are others that are less so. And so for businesses in this category, do you find it hard to get this, or that this certain industries may lag in discussing this risk, or are those factors that come into business owners' thoughts around psychological health and safety?
Yes and no. So personally, and within my own network, I think some of the specific industry associations are more proactive than others because the psych hazard side is so prevalent and obvious. So particularly more finance, office-based, might be more so, construction's had mates in construction, which has really brought mental health generally to the forefront and raised the profile there. And so naturally then they're fitting on the risk management side. I guess I wanted to just flick back a second to what you originally asked, Carlo, and one of the big things for me is this whole concept of looking at work health safety and psych health in a silo. And this is, I guess, the thing that frustrates me the most as someone who works with employers is, employers deal with, as we said, the HR, the workers' comp, the work health safety. And what I would really love to see is that kind of interconnected dialogue. So if you do have the individual presenting with mental health issues, whatever it may be, the immediate response would be that manager or supervisor taking a one-on-one type approach, exploring how they might more immediately assist them, perhaps even going the workers' comp path. So then in that context, it's then saying, okay, once we've dealt with this person in terms of providing them assistance and support, how do we then look at the work health safety? Was there anything from an organisational perspective that contributed to it, or was it purely a non-work related issue where we can provide that support from a work context? So I think it's that distinguishing non-work related work. Where is it coming in? Is it a workers' comp claim that's just been presented and they had no previous idea that someone was stressed in a workplace, which is also a very typical scenario? And really connecting the dots for businesses to say, okay, well, if you are used to dealing with it primarily from a HR perspective, then how do we build on that work health safety lens and complement your existing process? We're not trying to put that one aside and say you only have to deal from a work health safety perspective. So I guess I want to see more conversations like that start to connect the dots. And Ian, well done on your code. I know in early drafts we were talking about at least acknowledging the other legislative frameworks, and I think that's really critical in this space to at least draw attention to the fact that there is the interconnection of these other frameworks and even performance management coming in this space quite often. And that's a whole nother minefield that employers are going to have to deal with.
Yeah, and wouldn't it be great to see, and this is something that I think you can do both individually within your business, more broadly within industry. I think when an event occurs in a business, which really is around, there doesn't have to be a diagnosable illness. There can be harm caused or potentially even the potential for harm to occur, that we actually stop. And we know even in a recovery, in an allied health perspective, that the more allied health professionals that are involved in a recovery process tends to get better recovery outcomes. And so it holds true the fact that if you're trying to prevent risk on behalf of a risk owner and you're giving them interdisciplinary advice, we still investigate events either through a safety lens, and whilst that might be great from looking at a systemic barrel type approach as to what's generating that and looking upstream, we do find that well, personally from experience, that events tend to sit either within workers' comp, safety, or people and capability, and the event investigation process tends to be very different because of those frameworks that exist. So I think that's one thing you can do within your business. If you wanted to talk to those various functions that you either may be a part of or may be different to, we know that the new international standard for psychological health and safety is coming. It's 45,003. It sits within the family of 45,001 and looks to take a systemic approach to risk management, and based on the 31,000 standard of risk management. And so that would be an awesome step, is to get your counterpoint in those functions to say, hey, what are your investigation processes? Could we share? And when we get an individual who either, the absenteeism levels start to increase, performance starts to drop, people may have concerns about how they're currently focusing. And whilst they're all drift signals towards maybe a poorer outcome, at least then we've got a multidisciplinary approach of not just saying, well, the individual's got a problem at home or health conditions or something else. We may be part of that challenge that individual's facing, and we may need to lessen load so we don't have to put a performance improvement plan in place. So I don't know, Joel, from your side of things, if you were coming into a business and there was an individual that wasn't performing, what are the factors that you'd look at to try and improve the business, outcomes, or try and improve the business environment for an individual?
Yeah, I think, yes, there are hazards at work and there are hazards at home. And obviously, an employer doesn't have control over what happens in somebody's home life, and it doesn't matter how wonderful our working environment is. We have bereavement, we have divorce, we have, homes, ceilings collapsing and having to live in temporary accommodation for months at a time.
That sounds personal.
What a generic example that was. So I think that, speaking from personal experience, when I've had significant events happening at home, it's a matter of having, first of all, a trusting relationship with my manager where I can actually go and say, look, this is what's going on for me at home at the moment, just so that you know. And then that might be all that I need at that stage, is that I've told my manager what's going on. And then if things escalate, I can say, look, I need to take some time off, or I'm having a mental health day today. Can we look at my workload, my deliverables, and can we delay some of that, or can we reassign it? Can I reduce my working hours for a few weeks? Whatever it is that I might need, so that, yeah, we're reducing the work-related demands, because my home-related demands have increased so significantly that I can't cope. And there's nothing that I can do to reduce those home-related demands. So let's work with my employer to, where reasonable, reduce the work demands so that I don't actually tip into mental ill health. And then what the consequence of that is for my employer on the other side of that is I'm a lot more committed. They've done the right thing by me, and I recognize that, and then I'm willing to pay that forward, so I guess, an element of dedication. There's, increased discretionary effort, organizational citizenship behavior, all of those positive things that come out of it, retention, all of that kind of thing. So I think that, if you actually, as an organization, willing and able to make that investment to support your employees, then it definitely pays off in the long run.
Yeah. And I think this is the hard part for most people, as to where does that sit on the hierarchy of control? Where does that integrate into our normal processes? And I think that's often hard where when most health and safety professionals come up in from a professional development capacity, it's really rammed down our throats to say, work above the line, engineer things out, isolate things, eliminate it, those types of things. And we deal with those things at home, or those business constraints which aren't movable. It's really challenging in that aspect. And so, Carlo, acknowledging that it's quite challenging for that to fit into existing frameworks for physical safety, and there's this floating concept of psychological safety in psychology. How do existing WHS practitioners transfer their skill set over and be confident that they're delivering, and improving upon and lowering risk within their business?
I think there's a couple of things there, and in response to your first question of how does what Joelle was talking about fit into the hierarchy of controls? Well, the scenario that Joelle just outlined could only happen with a bunch of controls being enacted. You were talking, Joelle, about a workplace scenario where there was good regular supervision, where there was good positive relationships, where staff felt safe to raise concerns and felt safe to be able to say, hey, I need some time off and I need to adjust some things. So some of the controls, some of the work design controls, which is what we want people to do for psych hazards, were in place. That was a system that was working, such that when a individual had non-related issues happening for them, that those could be accommodated and not cause work-related harm on top of them. So that's how it fits into the hierarchy, I think, to answer that first question, Wade. Sorry to keep going backwards. But look, in terms of the hierarchy, I know there's a debate about which framework should be used for these kinds of hazards. And I think a lot depends on how you view the hierarchy and how you use it. Sometimes people get very caught up in the labels on the hierarchy, and it can sometimes be very difficult. And I'm talking about hazards generally. It can sometimes be very difficult to distinguish between, saying, well, this particular proposed control is an engineering control as opposed to a substitution, as opposed to an isolation, as opposed to whatever else.
And we raised up before around the intersectionality and sort of the multiple disciplines helping. So I think if we took, and I do want to frame this like, I think this could be used by some people to be an either or conversation, but I'd love for you to sort of expand and make it a both and conversation as to what else could complement it, or would make things easier, because we are dealing with different levels of people who may never have heard of the hierarchy of controls at all.
Sure. Do you want me to run through the hierarchy of controls then, Wade? Is that what you're saying?
It's more to outline to people that and probably for those that are on that are listening that understand it, they may not know any other model outside of the hierarchy of controls. And so I think we've got a gap of context to say there's multiple people who have vested interests and knowledge that can contribute to lowering this risk, but it's how do we find that middle ground? So I think it was more recognition of, don't get tied up into which is the best or which is the most right. It's around, well, what could complement and outline it at a greater level of truth and be related to people's experiences.
Sure, it's about what framework that you use that will be the most effective. And in terms of most effective, what I mean is control the hazard at the source. So I'm not really concerned whether people call it elimination or isolation, or engineering or isolation or substitution. I'm more concerned with hazards being controlled at the source, using the best complement of controls, knowing that it's not going to be about one risk control necessarily, sometimes, yeah, but what suite of controls can we use to control that hazard as close to the source as possible. The other model that's used is variously called primary, secondary, tertiary, or a levels of intervention approach, which is a more time-based framework, as opposed to the hierarchy, which is thinking about engineering controls down to PPE. I think that there are scenarios where using one or the other is okay. I think that some people and some work contexts are more familiar with the different models. I don't know that, if you see problems with one, I don't know that the other necessarily solves them all and without introducing new problems. So that's the nub of the controversy, I think.
Yeah, and Jen, I think this goes often to discussing about models, but realistically, it's a discussion around what's effective, what is going to work, and people want to invest time, money, and effort in things that work. So, in frame of that conversation, either in around a framework of controls or the controls, the current paradigm, which largely rests upon sort of reaction and support, how sustainable is that moving forward?
Yeah, I guess I have been pretty loud in my opposition to using the hierarchy of control for this area. It does work. I will give everyone that, but I just don't think it's a practical tool that a lot of business owners and practitioners will easily be able to apply to psychosocial risk. So that's where I have my hesitancy, and I think there are better ways to do it. It horrified me, for instance, when I saw an early version of some regulator, definitely not you, Ian, so you can relax, but a regulator who said a good way to eliminate risk would be to remove all shift work at nighttime. I was like, well, the hospitality industry won't be happy about that, nor any job really that requires nighttime work, and that is not a sensible elimination control. So my problem is people will get too caught up on, is this an engineering solution? How do we use PPE? Can we build that in? What about policies? And I think they miss the point. Which is why I would like to steer away from that hierarchy language and more talk to how do we minimize the risk. Like essentially, that's what it comes down to. Have the conversation about what will work in our workplace to minimize the risk. And that is going back to the conversation with workers and looking at, maybe existing controls. I do think there are some, like with occupational violence, for instance, where you might have the try to eliminate option that is quite clear in terms of the physical barriers, for instance. But there are probably only a few when you're talking about the job design hazards. So things like organizational change management, or even the relationship aspects, the workload, underload. To talk about elimination, to me, I just find that a very difficult discussion, and it's more, how do we minimize the risk? So
yeah, and this comes to this requirement under the legislation around, as far as reasonably practicable. So Ian, I mean, this is a really hard area, especially with inherent risks that are present which can't be eliminated. So, if a duty holder came up and said to you, hey, how do I measure that? Like, how do I define even what's reasonably practicable in this space? Look, I know, if I can prevent falls from a roofing code of practice, I know I need to put my barriers up. I know I need to put my people in harnesses. I know, can I do the work on the ground? That's well really, I think understood by a lot of people. But when a duty holder comes up to you and goes, "How much is enough?" How do you answer that question?
Yeah, it's a common question, Wade, I think, and there are some hazards out there where what's reasonably practicable has gotten quite prescriptive. So we started out with the risk principles kind of Robin style legislation, and for some of those hazards it sort of moved into a more prescriptive kind of standard for what's reasonably practicable, and you can find that in codes and the regs. But for the psychosocial hazard space, what I would say is it's actually probably more about the principles, not necessarily the particular control measure that you come up with. But when I go to a workplace, I want to see that there's a process that you followed to try and identify that control measure. So in my mind, it's not a judgment by outcome. You're not going to get it right all the time when it comes to human behaviour. It's just not possible, but we do want you to be following some sort of process. And I think that's where for me, it's kind of more about, I think the hierarchy of control diagram can cause people a lot of anxiety, and they almost kind of close off when they see it and go, "Oh, I can't eliminate human behaviour. That's it. I'm out. I'm done." But actually, the principles behind the hierarchy are really what's important, and those principles are reflected in the legislation that you must eliminate. And if that's not reasonably practicable, then move on to minimise. So you need to, as Carlo, I think, said, talked about that sort of root cause, moving upstream and trying to identify what the cause is. That's really the start of what's reasonably practicable. Have you looked further upstream? Do you understand what the context is for what you're looking at? And then that's what you need to do, within that team or within that scenario. And then I'd encourage you, when you're working out what's reasonably practicable, to go to the guidance material. Like, that's a really good place to start. And I'd also take a look at what the Act says around what's reasonably practicable. The Act says that you should consider a number of other things before you consider the cost when you're trying to determine what's reasonably practicable. And some of those other things in the psychosocial hazard space are around, what should you know about psychosocial hazards? I'd argue that you probably should know that there is a thing called psychosocial hazards, and I don't think everyone does. And I think some people just don't believe that there is. So, you need to kind of start there. What should I know about psychosocial hazards? What should I know about what's happening within my industry? What are the, more common hazards within my industry? And then what are the more common hazards within my work groups? And you can use survey data and things like that to sort of help you work that out. So I kind of bring it back to the legislation when I think about what's reasonably practicable. What should you know? What's your data telling you, and what does the guidance tell you? They'd be the three.
Yeah. And so, and that's an interesting point, because I think most duty holders are really trying to prevent outcome rather than actually going through a robust risk process. So, I mean, Joel, from that perspective, ignoring, things like, what we call things, what is effective at preventing these types of either events or diagnosable injuries for occurring, but actually, what is really, what is working out there in field that's preventing harm to our people? Like, are there examples that you can draw on that may be either, maybe able to be implemented right now, or things that might be, need to be considered in the future that we're going to be able to see more of? But, following that risk process, what's going to deliver us, really, strong, robust risk management?
I think from a process perspective, I think about the idea of defences in depth, and that's probably a more complex model to apply than a simple hierarchy. But I think that it sort of better represents that sort of crossover of disciplines that Jen was talking about, and, the role that all of those disciplines actually have to play in this space. So, you do need to have those things like policy in place that actually set the expectations and permissions for supervisors to be able to take action when they see that it's necessary. For example, you need to have the, flexible work options or those types of things enabled as well. So, there are a lot around what we would typically call administrative controls, but those actually need to be in there because they enable then some of the other sort of preventative controls and the job design type of controls. So I think you need to think about the permissions that you've got in place within your workplace as a starting point. There's a lot around upskilling of your frontline supervision as well. I think that that's a really critical piece of this puzzle, because ultimately the way that your supervisor responds to an employee who's experiencing distress or who's approaching a point where they're going to start to become ill is probably one of the most critical aspects of actually preventing that tipping over into mental illness. So, giving them the skills to recognize what's going on, giving them information about how they can actually respond, what are the different options available to them, and giving them access to the right advice as well. So, who can they actually talk to about this if they need help in actually providing that support to employees. So that was a lot of words there, but I guess making sure that you've got the right policy functions in place to support whatever mechanisms need to be then subsequently put in place, and upskilling your supervisors.
And I might just finish with one question before we go to Q&A. Carlo, is there anything that we need to stop the knee jerk in certain areas that actually make things worse, when these types of either incidents, events or illnesses come up in our businesses? What are the things that might be happening in a typical organisation that definitely isn't helping?
That's a good question. I'm not sure about knee-jerk when we get to incidents. I mean, there can be a range of them depending on what the kind of incident is. There's sometimes a knee-jerk reaction to, for example, go to mediation. I think that's sometimes problematic because it can't always be engaged in fairly, for want of a better term, or with consent of everyone. It's sometimes forced. So I think there's sometimes a knee-jerk there. I think it's also important to think about when an incident occurs, what the ongoing risk is as a result of how the incident is being managed. And I don't think people really think about that risk. So what happens when you've got two parties and you're separating them, or someone goes on leave? What happens to those people in terms of, if one of them's back in the workplace or they're both away, and what are the impacts for them? I also don't think that we're dealing particularly well with people returning to work, whether they've had a psych injury or any other kind of injury. They're at higher risk of psych injury, for want of a better term, not just injury, but they're at greater risk of psych harm. We're not dealing with that very well either. But adding those things on makes it a little more complex, and we want to make sure that people aren't too afraid to get into this space. They've got to approach it first.
Yeah, no, you're very much right. No, I've seen examples where people, people and capability may have taken the lead on an investigation, and then from that point there, they've conducted the investigation. It hasn't met the definition of bullying, and that individual goes back into the same work environment which was causing that harm, yes. And then goes off and then submits a workers' comp claim. It's then accepted. And because of the different burdens of proof, and then leaders go, well, what do I deal with? So
it's a terrible scenario because no one's applying a risk framework in those investigations, yes. And that to me is one example of where we need to, as Jen was saying before, think about how HR and WHS are working together.
Yeah,
because those risks are not being managed.
Agreed. And I think I might jump to the first question now, is around, where does this psychological health and safety and psychosocial concept fall into illness prevention? So, there's a lot of people out there doing workplace, health promotion programs. There's about awareness and those types of things, and they're not done in consultation with risk management processes. So, Jen, you would see this with both mature and non-mature businesses. What are some of the mature businesses? How are they straddling that divide to acknowledge that awareness and health promotion are required, but also a greater level of risk management is needed?
Yeah, this is a tough one. What problematically, I guess, for me, is when you have regulators talking about mentally healthy workplaces and confusing that with psychosocial risk management. So that's probably the number one thing that I would want to stress. Can we please stop using mentally healthy workplaces from a regulatory perspective, because they are two different things. So to me, the message that I always have for employers in my network is, look at the promotion and health programs as an additional benefit and something that is good from a HR and a employer of choice perspective, and that ultimately builds protective factors for your workers. But it doesn't necessarily mean you're going to be compliant with all of the legislation. So it's that awareness of, yes, you might be doing a good thing, but now you need to look at also that compliance side and the risk management process. You might find that some of those health promotion activities are good controls, or can be moved across as part of your risk management process. So it's almost about changing what lens are you looking at it, to go, okay, if we do have, good forums or consultation groups where we talk about what activities are we doing, what do we like, stresses, whatnot, then that could be a good consultative mechanism that we can then transition to looking at more of the risk management side.
So Jen's just pulled the rug from health promotion, engagement surveys, all of those processes. Joelle, I'm sure there's a couple of people and capability people and remuneration and those focused on that saying, I thought I was doing the right thing, that the bottom might have fallen out. So how do they critically look at that and then, fall onto the right side of where we need to be?
So I think a good frame to look at this is, well, where do these interventions actually hit? At what stage in the mental health spectrum are these interventions targeting? And for the most part, they're focused on raising awareness about mental illness and reducing stigma around mental illness. So what you're focusing on with those interventions are people who are already unwell. And I think that if people can actually start thinking about, is this actually prevention, and not prevention in terms of early intervention when people are already starting to get unwell and we're just stopping them from escalating into being really, really, really unwell, but actually taking the hazard-based approach. That's what we mean when we're talking about prevention. So yes, reducing stigma is important. Yes, getting people into treatment early in their illness trajectory is important because you're reducing adverse outcomes, but it's only one part of the picture, and it's certainly not addressing the risk that's present in your workplace.
And Carla, do you think we have a unique point in time coming up soon with the release of ISO 45003 to recast, at least in some organisations that are aware of compliance or having systems in place to international standards, that might be able to get this onto the agenda and maybe redefine or maybe realign what we mean by this concept?
Yeah, I think it is an opportunity. 45,003 is a child standard of 45,001, and so it takes that very systematic approach. It's an occupational health safety management system standard. So 45,003 is helping to explain the elements of 45,001 related to psych health. So it's very much focused on bringing these issues into the regular system that you have for managing occupational health and safety, as opposed to standalone kind of events that may not be documented, evaluated, monitored, as you would do in an occupational health safety management system. So there is an opportunity there. It's showing organisations that this is part of regular health and safety management systems.
Perfect. And Ian, I know. Go for it.
Sorry, because this is a topic that again I'm very passionate about. So Carla and I sit on the same committee at Standards, and I've been vocal as usual. I guess just to highlight from my perspective, I think the standard won't be helpful for most small businesses because it is quite complicated. The language that it uses, being an international standard, might not correlate to the language we use from our work health safety legislation perspective. So there are some concerns that I have about that, and I guess a base level understanding of this space to be able to use the standard effectively. But then I think for medium and large, it is a really good tool to do what Carlo said in terms of that higher systematic level approach. It might get you thinking about elements that you might not have covered without looking at that standard. So I guess a bit of caution there for small businesses.
Yeah, that's a fair comment. Though I think that the manner in which the standard is talked about, examples of hazards and examples of controls, could be something that small businesses could use. So you don't have to use all parts of the standard, but I think it does provide some good guidance on getting some consistency around how we talk about the hazards and how we talk about possible controls.
Yeah, and I think there's a question around, is regulation of wellbeing problematic or helpful? And I think I've seen this work really well in certain industries where supply chains become engaged and clients insert things like compliance to certain standards within their procurement supply chains as a condition to supply to those quite large businesses. And we've seen that in either increased reporting, transparency, or even down to, compliance to certain things to be even able to tender. Now, the flip argument of that is that it's a lot harder for small businesses then to tender and win work when there's more and more compliance burden placed upon them. But Ian, from a duty holder's perspective, if I was sitting in a business and I wanted to know, if some reporting was coming to me about this area, and I wanted to both highlight, well-being as well as at risk, what's some good data that I could either be comfortable on or sort of acknowledge that I might need to do further in my business? Have you seen any good reporting that maybe individuals have shared with you within their businesses around this area?
Do you mean the data coming from their workplaces, Wade?
Yeah. So as in, how do I, as a duty holder, feel comfortable that the level of risk that I have accepted in my business and that I'm funding from a resourcing perspective is actually occurring in the business?
I think the best example I've seen is a medium-sized business. So the reason this one stands out for me is that they had identified their workplace data was telling them that they had an issue with, what I call harmful workplace behaviour. So that's, by far the one that's talked about the most when we talk about psychosocial hazards is certain types of behaviour, bullying, harassment, etc. And this particular business was probably quite ahead of their time a few years ago when I bumped into them. They had recognised that they had an issue with workplace behaviour coming from certain hotspots within their organisation. They also recognised that often this sort of behaviour is the symptom, not the cause, and they recognised that a lot of workplaces kind of fell into the trap of just responding to it through a potential code of conduct breach or, off to professional standards or HR, which absolutely needs to happen. But what they recognised was that they probably needed to look at it from a work health and safety perspective. So they organised a small group, say like a small steering committee within their workplace, and they trained that small committee to have more understanding around the work health and safety framework and more understanding around psychosocial hazards. And they also put some systems in place to support them around de-identifying certain workplace data, what are the limits of privacy and confidentiality and what information can be shared with that group. And basically what they set up was a small system where they were capturing data from not only their workers' compensation team, but also from their HR team, so that's bullying, grievance complaints, and their work health and safety team, which is getting the hazard notifications. And they also started to take into account absenteeism and turnover and exit interview data. And they really kind of started to collect all that data and sat down as a group fairly regularly and discussed, are we at a point now where we have an issue in, the team for the Simpsons fans, Sector 7G, we've had a couple of issues pop up on our radar now from that particular team. Do we need to act on that? So that's the kind of process that they set about. And I really like what they were doing there. Yeah.
Yep. So Joel, we've got sort of, we can track sort of those outcomes or loss outcomes, workers' comp claims. We can track things like, allegations that are being made or potential breaches of things and investigation findings. We can track, committee raising and sort of activities that we're doing. So things like training, whether we're having open conversations or whether we're training people to have open conversations and those types of activity-based metrics. But I mean, how do we start the conversation around measuring load upon people and getting good data in that area?
Load as in
there was something recently in the media around, I think published by the WHO, around how overwork contributes to increased rates of heart disease and sort of those types of outcomes. So, that's clearly an outcome of having too much load upon people or designing work so that they're at work too long or responding or those types of things. So how do we get to that type of data to help our people say that either we have a problem or we need to do something about something?
Well, asking them would probably be a good starting point. Yep. And having, obviously
when you said asking someone, are we talking engagement surveys or, because we're doing a lot of those at the moment. So is that reliable data?
I think that you want to be targeting what you're actually trying to measure as closely as possible. So, any survey, I guess, is a proxy indicator of what you're actually wanting to measure. So you want to be getting your proxy as close to the actual data as possible. So, I mean, what do you mean when we're talking about load? Are we talking about working hours? Are we talking about if somebody's in a role?
For instance, so for instance, I've got payroll data. So I know that, or I've got clock on systems. I know when people are at work, but often that's just a very blank baseline data. I don't know how much work people are doing, or I don't know how that's affecting their thing. So I'm struggling in that respect as to if I'm a duty holder, how do I know that I've either assigned enough or not enough work? And then, I've got those when it gets too bad, when absenteeism or workers' comp and those types of climate, findings happening. But, how do I get upstream? Because if I was going to apply this to, let's say, a physical safety process, I'd be doing inspections of are critical controls in place to prevent material risks. So I'm getting further upstream. So, how do I get that data to either my board, my executive leadership team? Because I'll be honest, narrative's great, but also, when we measure things, they tend something to get done. So is there any way that we can shift upstream and get that data? Anyone else can jump in too, by the way.
I can jump in. I mean, Wade, I think you've outlined a whole boatload of metrics, and you've got them for years. You can look historically and you can look at trends. So you don't have to look at, this week. You've got those data. You've got rates of overtime. You've got absenteeism. You've got completion rates, whether things were done on time. You've got information about quality. Were there issues with errors or things not going as planned? So you've got a bunch of data sitting there.
So do we need more data? Or do we just need to link it and frame it better, I think is the question here, because often people look for something new when actually is it just better organising it and accounting for it?
I think a lot of it is using what you've got to answer new questions.
Yeah. So, and this is an interesting discussion. So sorry, Jen, go.
I was just going to jump in because I saw one of the other questions was around what framework could we apply that helps us evaluate effectiveness of controls. And I think this links to this question about data. I have a problem in terms of data can be great to help identify risks, but I really, really don't think we have any good evidence around what are effective controls. and how do you measure the effectiveness of controls, which I guess was the reason we've been so reluctant to support more regulation in this space, because I felt that until regulators and practitioners could articulate clearly these are well evidence-based controls that work in XY situation, and we have that real evidence base, that we couldn't ask people to do a prescriptive approach to this. So I guess that's where I would like to see a lot more research in this space. The problem is, this is a subjective area. It's not as objective and clear-cut as with physical hazards. You don't have near misses that get reported, or not in the same way. And so I think there's a lot more work that needs to be done there. And I know, Carlo, we disagree on this one, but this is where the academia and the science does tend to have different views. So I think it is.
And is there a case where, there's an existing adjacent sort of process that we have in occupational hygiene where, we respond to, things like noise, exposure to chemicals, certain carcinogens, certain, airborne contaminants, those types of things, where we have things like workplace exposure standards, time-weighted averages, short-term exposure limits? Is that a better model than, say, binary, you need this in place, like isolations and those types of things, Carlo?
I don't think we're going to get to that. I don't think we're going to get that prescriptive. Nobody really wants us to be that prescriptive. But on the issue of evidence for control strategies, I think that's a really complicated one. And, different people require different things of the evidence. And, how specific do you need the evidence to be? Do you need the evidence in your particular workplace? Because if you need the evidence for that, well, okay, get it. Let's get it in your particular workplace. Versus how more generic would you allow the evidence to be before you would accept it? And there's all different kinds of evidence. I think that the evidence issue on this is a really fraught one. But if anyone wants to help get more evidence, let's go. Let's have the data.
No, you're exactly right. And that's where you see existing. I see more movement at the industry level a lot of the time, where people feel more confident to see, well, this is what I'm seeing within my industry. Can I find other partners that are in my industry? Because we're sharing the same employee pool. I see there's a genuine goodwill in this area to sort of nut this out and do better, but also then engage with people like law societies or other types of professional societies where the profession, as part of CPD, can we get this into curriculums and those types of things? So it's interesting that maybe if you're not confident within your own business, to reach out to others within your industry as to where they're at, and then maybe go and have a chat with individuals who can undertake some research. So, healthy minds, healthy shed. So, I mean, Ian, there's a heap of SafeWorks involved in this. Is there any that you'd like to raise that is currently leading the way?
Look, there's a number of initiatives, I guess, coming out of, not only New South Wales, but in particular New South Wales, with the refresh of the mentally healthy workplaces strategy. And I'd just say on the controls discussion and trying to evaluate, the effectiveness, it's really, with the psychosocial hazards, it's really context specific, isn't it? So, it's really coming back to the work group. What works for a particular role might not work for the team in the cubicle next door, because they do a different type of job. So it's really hard to be prescriptive around control measures. In terms of what's working in this space, I think, there's some literature out there now. We did a bit of background research leading into the mentally healthy workplaces strategy, and we've been following the work of the Black Dog Institute here in New South Wales, obviously, around the effectiveness of various interventions. And we're all pretty familiar with, the PricewaterhouseCoopers report in 2014. And then I think the University of Sydney did some work for us leading into the strategy around 2017. And both those reports estimated a particular return on investment for interventions. Now, it's difficult to really kind of to really show, I guess, a causal link in that sort of research. But, it does indicate to us that if you invest in the more systematic and organisational wide initiatives, you're probably going to get more of an impact than if you focus on the individual level initiatives. And the other thing I'll finish on too, Wade, is I don't like to bang on about a return on investment all the time, because we still need a bit more research around that, I think. But also, we don't want people to think that they need to deal with these hazards because they will get a return on investment. It's the right thing to do sometimes, most of the time, and it's the law. So, but there was a pretty high estimate in Sam Harvey's research on the return of investment for manager and worker mental health training, and that's what we'd consider to be kind of down the lower end of the hierarchy principles. But he kind of found that there was he estimated, that there was a high risk work group, but there was a pretty high ROI for that. So I think, when we're talking about what's out there and what initiatives are out there and what we know, we're definitely building on it. Yeah.
Yeah, and that's a good point, is the fact that, and this is a question that came up in the YouTube feed, was Tony Whitcomb said, we need to be comfortable that the evidence to support the success of controls may longer be hard, and how do the industry and regulator react to this? But to actually, to the point that's on the screen now, is around how do WHS practitioners and those that have a vested stake in this, maintain or improve their knowledge? Because often, if we don't have, it's not a really good answer to go to your executive team, I'm not sure, we need to trial a few things. I've got some educated, you don't want to use that guess language. You want to have that, hey, this is what I want to do. So, to that point, Joelle, I'm sure that then an executive board level would say, well, I've read, all this stuff about psychological safety, and then they conflate that issue with this. So, can we just end, I think, on that query around, well, how do you, I'm not going to say stops the principles of psychological safety coming into a business, but how do you keep the concept of psychological safety and psychological health and safety sort of separate, but still trying to use the momentum if one does sort of come over the top of the other?
I think that, yes, they're distinct concepts, but they're also related in that, psychological safety is a protective factor at work. And a lack of psychological safety can be seen as a hazard at work. And when we're talking about, some of the points that I was making about, being able to raise these issues with your supervisor, having mechanisms in the organisation that actually allow the organisation to respond when something does start to go wrong. All of that is sort of based around the presence of psychological safety within that workplace. So really it's about, people feeling safe to be able to speak up, to question, to challenge, and to admit when things aren't going well, and know that they're safe to do that. And that's essentially what psychological safety is. And when we're then talking about psychological health and safety, we can see that it is very distinct, because we're talking about a systematic approach to hazard identification, risk management, and promotion of positive health. So, for me, I think that they are really quite distinct. It's unfortunate that they are getting a little bit conflated. And I think, the more that we can do to sort of intervene in that, where we do see those terms being conflated, the better off we'll be.
Beautiful. Look, I think I sort of want to leave it there, give Jace a couple of minutes just to wrap up some of the key learnings from his perspective, obviously working hard behind the scenes. But I have been watching the YouTube chat, and I must admit some of the queries and discussions that are happening through that are really good to see as well. So please don't think you just have to sit here and listen to a screen and take perspective. I think it's about getting out there, asking people, challenging, testing, and finding that sources of information, then most importantly, embedding it in your own knowledge, and then how you implement it in your own business. So over to you, Jace.
Yeah, Wade, that's a great way to sum up the conversation today. There's, competence is a big thing that we need to build, and there's obviously a lot of good information out there. What we will be doing with this webinar following today, as quickly as possible, we'll get this out on YouTube and also on our podcast, so you can listen to it if you don't like to watch it. Unfortunately, Wade, we won't have it as a transcript anytime soon, so you won't be able to read it back. But we will link in our show notes to some of these great resources that have been spoken about by the great panel. So on that, thank you very much to the panel for your time today and your generosity with your expertise. This is the second time that you've appeared on the Psych Health and Safety podcast, all of you. So thank you so much for sharing your wisdom. What I'll do is we'll say goodbye to Carlo and Jan and to Ian. So thank you all. Wade, thank you so much for moderating it. You did a hell of a job. Anyone would have thought you've done this before, mate. So well done being able to juggle some great subject matter experts, but also some of those comments and questions that came into you from the live audience.
Thanks very much. Appreciate it. It's been great.
Great. No, thank you, Wade. So on behalf of Joelle and myself, thank you very much for coming along to this live session. If you did come live, you may be listening to this on the podcast later. I would like to take this moment in time to thank so many people for registering for this event. Given how many registrations we had, I know not everyone could come live. I think it got up to about 250 people live, which is amazing and definitely exceeded our expectations. But given the popularity of this model, we've already decided on our next panel, which will follow soon after the release of ISO 45003. So it'll be quite topical. And we will be including people from Canada and the UK at a much more friendly time for those people as well. Which will be, sorry, one moment. We'll bring up the panel. So representing the UK will be Peter Kelly from the UK HSC, Marianne Bainton from Canada, and I'll be doing my best to represent Australia on that next panel, yet to find the right moderator for that one, given that it was last minute that we pulled it together, but a much more friendly time for UK and North American listeners. But sure will be a topical discussion given the release of ISO soon before that, and also Peter Kelly and Marianne Bainton having such early impact on the development of their country's management standards as well. So on behalf of everyone, thank you again for coming along to this panel, and we will catch you on the Psych Health and Safety podcast next time. Thanks, everyone.